That's a difficult act to follow, so I'm not in an enviable position here. Irene had lived in an adult home for 16 years, living in an institutional setting, being deprived of opportunities to make her own decisions, being deprived of being the human being that she is. And I think Irene's story and Lois's story really bring down to the ground level what our work is all about and what the meaning of this 10th anniversary of Olmstead is all about. Olmstead is a civil rights law that affects real people. And the decision in the Supreme Court, although a powerful decision, has still not had the impact that it should have for people who have mental disabilities. Lois and Irene are anomalies. Thousands and thousands and thousands of people remain in institutional settings that have various labels that don't sound institutional, but nevertheless, that's where they've been consigned. For that reason, the Bazelon Center has issued Still Waiting, the unfulfilled promise of Olmstead. And we are hoping that it gets wide distribution, because what we see this as is our call to action after 10 years. And I'll summarize for you just some of the particulars that we're calling for. We're calling for Congress, as it contemplates health care reform, to consider the needs of people with serious mental illness that really require involvement by multiple systems. People who have serious mental illness are not simply within the domain of mental health. They have housing needs, they have substance abuse needs, they have employment needs. The unemployment rate among people with serious mental illness, as referenced in our report, is over 70%, which is shameful, of course. We call on Congress to pass the Community Choice Act, which would make a package of home and community-based services mandatory in Medicaid programs. These are the services particularly tailored for people who are at risk of or who are now in institutions and can live in the community, as Lois and Irene. We call for the Center for Medicaid and Medicare Services to expand the array of services that are available for people in support of living in their own homes, and to encourage the use of home-like settings for people who need out-of-home placements, such as therapeutic foster care for children with serious emotional illness, and for supportive housing for adults. Supportive housing is what Irene is now living in. And the program CIAD is the provider of services to, no.
No, CIAD is the advocacy agency that has given us our voice.
Thank you. We call on the Department of Housing and Urban Development to provide incentives to create permanent supportive housing opportunities for people so that, like Lois and like Irene, they will have their own address. We call on increased funding for reentry programs for people with mental illness who are leaving criminal justice settings. We call on the Department of Justice to rigorously enforce Olmstead and to adopt legal positions that support Olmstead outcomes. We call on the President and the Senate to consider federal judges and Supreme Court judges who have an understanding of and sympathy for disability rights issues. And finally, we call on states to do some things that Irene just referenced very, very eloquently. Irene referenced being considered almost as if she's the product of an industry. And an issue that we discuss in our report, excuse me, that's rarely discussed is that, in fact, there are vested financial interests in maintaining the status quo. There is a whole industry that thrives on providing institutional care to people who could otherwise live in community settings. And that requires some political action by states. That requires states to finally uncover and address the fact that there are powerful political lobbies working on behalf of institutional settings, and they affect the decisions that are made by state policymakers. We call on states to lose their silo mentality, meaning that as on the federal level, the needs of people with serious mental illness transcend state departments. And often state departments work at cross purposes. It's the role of state government to look out for the interests of its citizens, and that requires bringing together state departments to provide services and supports that will be effective in assisting people living in their communities. And we call on states to reallocate funds that are now tied up in segregated settings such as adult homes and archaic settings such as group homes that were devised in the 1970s as state-of-the-art, and to really promote supportive housing for people with serious mental illness. I hope that our program today has helped you understand both the reason to celebrate today, to celebrate today's anniversary of Olmstead, and to consider what needs to be done.